I'm approaching the scene. The scene is safe. I'm happy to proceed. I'm going to provide privacy for my patient, and then I wash my hands for 20 to 30 seconds following the WHO guideline. After washing my hands, I'm going to approach the patient. Hello, good morning. How are you today? Says fine, all right. My name is Ipinye Minima and I'm a registered nurse. I'm one of the nurses who will be looking after you today. How would you like me to address you, please? She says, call her Ruth. Oh, Ruth, nice to meet you, Ruth. Ruth, is it okay if I confirm your name using your wristband and my document here? Ruth says it's all right. Oh, bless you, love. I'm just going to check. I have here Ruth David. Date of birth 16 June 1997. 16 June 1997. Hospital number 123456. Hospital number 123456. Oh, I see. So I have the right patient. So Ruth, do you know if you have any allergies to latex, to food, to nuts, whatever? She says no known allergies. All right, that's okay. Ruth, you know you'll be discharged today by 4 p.m. and your doctors are happy for us to remove your urinary catheter. Is this a good time, darling? She says yes. All right. So I'm just going to quickly get everything I need and come back if that's okay by you. She says yes. Would you like me to change your position? She says no. Please feel free to press the call bell. I'll be back. I'll wash my hands for 20 to 30 seconds following the WHO guideline. Hands are neat. So I'm going to assess so I can confirm my trolley has been cleaned. Everything I need is ready and calibrated for use. So the first thing I'm going to bring now is my 10 ml syringe. I can see here my 10 ml syringe is intact. It's intact. It's not broken. It's not expired, and it's never been used. I'm happy to use it. It expires in 2025. I'm going to put it in the trolley. I'm going to also bring out my receiver. My kidney basin is clean. It's never been used. I'm happy to use it. I'll drop it there. And I will also bring out a towel, a neat towel from the sterilization department. It's never been used. I'm happy to use it. I will drop it there. Removal of catheter. Well, and I'll also get my normal saline for cleaning my patient. It's intact. There are no precipitates. There's no leakage. It expires in 2025. I'm happy to use. And I'll get my 2 gauze squares in their pack. They are intact. They are not broken. I'm happy to use them. They expire in 2026. I'll put it on my trolley. So go back. Hello, Ruth. I'm back now. Are you still happy for us to go ahead? She says, all right. I'll just take a moment to don my PPE. I'll quickly wear my PPE. Wash my hands for 20 to 30 seconds following the WHO guideline. I'll don my PPE and come back to Ruth. Hello, Ruth. So I'll be going ahead now, okay? I'll give you the instructions to follow if that's okay by you. She says, all right. So I said so. If this was the clinical setting, as I can see now, there is no urine. But if this was the clinical setting and there was urine in my urine bag, I'll measure it, discard it, and record it in the intake and output chart, and then proceed to remove my catheter. So saying that there is no urine, I'm just going to proceed and remove my catheter. Okay, so Ruth, I'm going to be placing this urine bag on your bed. Don't worry, it's not dirty. So I'll just place it there so it can be easy for me to take it along with me when I'm going. Is that all right? She says yes. So the first thing I'm going to do now, I'll open my syringe and take my syringe using a non-touch technique. So Ruth, what's going to happen now is that I'm going to place this towel over your pubic area to provide more privacy for you as I'm removing my catheter. Is that okay? Do you feel okay with that? She says yes, because I have to maintain your dignity. She says all right. So the first thing, after opening the syringe, using a non-touch technique, I'm going to take the syringe and then deflate the balloon, looking out for 5 to 10 mils of urine, depending on what in fact, I can say it like this. Let me assume that my paper says it's 10 mils of fluid that was used to inflate. So I'm going to deflate the balloon, looking out for 10 mils of normal saline, which was used to inflate the balloon. So after withdrawing it and it's 10 mils, I'm quickly going to discard that in the kidney basin, and then using a gentle downward and firm traction, I'll pull on the catheter, pulling it out. So Ruth, if you can take deep breaths for me, okay? I'm so sorry, pulling it down. I'm so sorry. You feel a little discomfort. Is that all right? She says, fine. Okay, that's fine, Ruth. So I'm done removing it now. I'll quickly discard it, discard every other thing I've used, keep the place neat and tidy, wash my hands, discard my PPE, then wash my hands for 20 to 30 seconds following the WHO guideline, and I'll come back to Ruth. Hello, Ruth. How are you? So I'm done removing your catheter now, but I have a few things to tell you. First of all, you might feel some urgency, frequency, and pain, like a burning sensation. It's actually very normal. There's been something strange in your body. So removing it now, it's not strange for you to feel discomfort, but it should wear off with time. Is that all right? She says, fine. And secondly, I would like to also advise you to please take liberal fluid intake, at least 2,500 mils of water. That's 2.5 liters of water a day. Is that okay? Can you do that for us, please? She says, yes, all right. I would also encourage you to mobilize. The reason why I'm telling you to mobilize is because, you've been in bed for a long period of time and your body has been dependent on this catheter to bring out urine. So we need your body to go back to its normal state of functioning before this time. So we need you to mobilize, come out of bed, walk around, and not too much. You don't have to be worried, but just do it from time to time. Is that okay? She says yes. You can also do mild exercises. All right? She says yes. And please, most importantly, once you pass your first urine, please inform whoever is on duty, the medical team. We are so eager, and we'll be happy to hear that you have passed the first urine after removing this catheter. Is that all right? She says fine. Do you have any questions for me? Do you have any queries for me? Ruth says she has no queries for me and no concerns. All right. About your post-catheter symptoms, if you feel like it's too much for you to bear, maybe the pain is too much, or the discomfort or the burning sensation is so much, please inform somebody, okay? Whoever is on duty at the time, inform somebody and we'll attend to your needs. Is that all right? She says yes. So I'm going to quickly document all I've done, Ruth, if that's okay. Ruth says all right. I'll document everything I've done and then tell Ruth. So I'll leave you with the call bell now. Let me go and attend to other patients. If you have any queries, any concerns, please press the call bell and let us know. Is that okay? She says yes. All right. So I'll leave the patient's bedside, wash my hands for 20 to 30 seconds, following the WHO guideline, and keep everywhere neat and tidy.